Good morning, everyone. My name is Monica Bharel. I'm the Commissioner of the Massachusetts Department of Public Health, and I'm thrilled to be here with you today as the moderator of this panel, where you will get to meet these innovative leaders who are at the cutting edge of addressing our current opioid epidemic. I'm particularly excited that this morning we are speaking about the intersection of policing and harm reduction. And that's because I know from our work in Massachusetts that that intersection is a place where we know we save lives. In Massachusetts, we've expanded our treatment opportunities for individuals in jails and prisons, where now opioid use disorder is seen as the medical illness that it is, the sickness, as you just heard about, and people are getting access to evidence-based treatment that works. In Massachusetts, our post-overdose support groups are going to individuals in communities, family members, and individuals, and providing not handcuffs, but naloxone treatment and support. So I'm so happy to have our panelists here today who will talk concretely about some of the work that they're doing to help you in whatever phase of this work you are. So for our panelists, I'd like to start, if you could talk a little bit about your work at the intersection of policing and harm reduction.
Sure. So again, my name is Allie Hunter. I'm the Executive Director of PARI, the Police Assisted Addiction and Recovery Initiative. We're a movement of nearly 500 police departments who are assuming new roles in light of the opioid epidemic and trying to find non-arrest pathways to treatment and recovery for the communities that they're serving. I also want to mention I come to this work with 2 close family members in recovery, so it definitely hits very close to home. So essentially what we do is we help police departments approach this issue in new ways and stand up programs that use the opportunity that they have to connect people to treatment and services, whether it's after an overdose or just a street level encounter, or an opportunity where people can self-refer to a police station, a fire station, or another location. And like I said, really just changing the paradigm in how police intersect with public health in response to this issue. So that's a bit about what we do.
Thank you. Neill?
So my name is Neill Franklin. I'm the Executive Director of the Law Enforcement Action Partnership. And what we are an international organization of criminal justice professionals. That's police, prosecutors, judges, corrections officials, parole and probation, and more. And we are a collection of expert speakers who have realized that the current approach to dealing with, public health issues is not one for criminal justice. And so we go out and speak about harm reduction efforts. We go out and educate our peers on how to do this work. We try to build a bridge between the police, prosecutors and others, and our drug-using community. We try to change language, eliminate stigma. Basically, our ultimate goal is to remove the many public health issues that have found their ways into our hands, to remove them from the criminal justice grasp, and, I don't know if return is even a word, but to give them to the appropriate hands of healthcare practitioners. That's pretty much what we do. And we believe that if we can get the law enforcement community to speak about this and to move this, that it will happen, and it will happen very quickly.
Good morning, everybody. My name is Devin Reaves. I'm the Executive Director of the Pennsylvania Harm Reduction Coalition. I think really what I do most is drive around the state of Pennsylvania and answer emails. But I think more important than what we do is really like what's our North Star. Our North Star is we want to end the racist war on drugs. And being a black man running an organization, doing that, we have a really specific goal in mind. How do we stop the persecution of people for making decisions about their own bodily autonomy? How do we center health and wellness in response to a totally normal activity? We all engage in different behaviors to deal with life, whether that's having a slice of pizza, smoking a cigarette, using drugs, and we live in a world where that's hyper criminalized and over policed, especially if you're black. And I think that's BS, and we're trying to get that out of here at the Pennsylvania Harm Reduction Coalition.
Thank you. So as each of you think about the work that you're doing, you know, if this was easy work, it would have already been done, right? So this is really hard work. You're really trying to move the needle. Can you think about something, as people think about their own communities and how they would do the work, is there a pivotal moment or action you took or something that led you on this path? You know, I think in Massachusetts, when we started for the first time looking at the intersection of data and criminal justice and health, and actually looking at criminal justice through a health lens, that really moved something for us. Is there something that changed for you that really can be reflected on?
Yeah, so before I started this organization, though I've been doing advocacy for a long time, I was the executive director of a treatment center, and I was like spending all this time competing with other treatment programs to get somebody into our treatment center. And that was the most ridiculous thing ever, right? Like, how do I help people that already have all these resources get into a center that's easy for them to do? And I was like, I didn't go get a master's of social work to do this, right? It's the system is keeping poor people, you know, people wrapped in the criminal justice system. And I like looked in the mirror one day and I think I hate myself. Like, this is not what I'm meant to be, right? Like, God's got a different plan for me. I want to be a change agent. And like, that's really what it was. It was nothing other than like, this is what I'm supposed to do. I need to find a way to be a real change agent because this system's so broken.
And how did you then find the work that you're
I mean, begged, borrowed, stealed, really. I called, it's funny, the executive, one of my colleagues that works at Prevention Point Pittsburgh connected me with one of her board members, a woman named Erin Russell, who's actually from Maryland. We wrote a grant, we got some funding from Drug Policy Alliance. That was the beginning. And then really the harm reduction community in the state of Pennsylvania underwrote our effort. Everything from helping with resources to administrative to grant writing. And you know, we're about a 2-year-old organization, and now we've got 3.25 staff, and we're out doing all these programmings, training law enforcement, community organizing, and it's exciting, and I kind of never thought it would happen. We just had a 300-person conference in our state, you know, so there's a buzz around ending the war on drugs, which is different than let's get people into treatment. And why that's really important, it's like, you know, we're working on the overdose epidemic. We're working on ending the war on drugs. We're not working with people. And there's a difference. And we've been so hyper-focused on that first part, getting people into treatment and those like micro solutions, that the macro solutions are not being funded. They're not part of the conversation. And people don't have an analysis of that when they look at the broader solution to this problem.
So actually, I'm probably more radical than Devin, but I'm retired police, so I got to be cool, right? You know, carry that persona. But anyway, so after 34 years of policing and spending most of my time in drug enforcement and arresting just so many people and running task forces that did the very same thing but with hundreds of people, it was violence that brought me to the place, losing comrades and the family, like the Dawson family here in Baltimore, whose home was set on fire and the entire family was killed because of our drug prohibition policies. I believe, even personally now, that all drugs should be legal. I know, but that's another conversation than harm reduction. But again, that's the ultimate goal: regulation and control for these drugs that our communities are using. But here's the thing with our organization, and that's where our organization began in 2002. Really radical law enforcement folks who understood this because they had been in the trenches day in and day out, and they realized that these policies do not work. However, not just our law enforcement community, mainstream law enforcement community, and our community at large are not ready for that. So we have to meet people where they are. And that's what we did a few years ago as an organization. We went through a reformation, and we realized that we had to meet people where they are. So one of the 5 silos of work that we do is harm reduction. You know, it is working with Allie. It is working with law enforcement assisted diversion and moving that forward. For today, for now, this is what's working now. But we always have to keep our eye on what's down the road, the bigger picture, and each day move closer and closer to it. So today, our organization is focusing on those those many moving pieces of harm reduction. And right now, one of the main things that we're trying to work on are drug overdose prevention sites. okay, SIFs. That's next. And as you can see, whether in Philadelphia or on the West Coast, that's what we're trying to move to. So.
Yeah, I think for me personally, like I mentioned, this is something that's affected my family. And so when I was hired as PARI's first executive director, it was really just because I could really relate to the idea that there's many missed opportunities when somebody's looking for treatment, looking for services, looking to begin their recovery, and not knowing where to turn. And like I said, having many missed opportunities. So what happened in Gloucester, Massachusetts in 2015, I think really was a game changer, because many law enforcement officers recognized that they can't arrest their way out of this, and what they were doing in the past was not working. And so this provided a new, very concrete, very simple solution where somebody could walk into a police station and ask for help. And this really changed the way police think about their roles in their community and started a bigger movement of police thinking about other intercept points and other encounters and other ways where they could provide that conduit to treatment and recovery as an alternative to the way they'd been approaching addiction in the past. So I think that really did kick off, like I said, a movement of police thinking about this issue differently. And honestly, a huge part of it is just in Massachusetts and a lot of other places, the overdose rates really skyrocketed. The potency of drugs available is different. And I think that police felt compelled to do more because they were going to too many funerals and they were seeing the impact on their community and their colleagues and families that they knew. So I think a lot of it had to do with the timing of that as well.
Yeah, you know, you raised that, and I was thinking about fentanyl as this game changer. There's such a small margin for error with fentanyl, so potent and deadly. And I think about people looking at the number of deaths and how that really shook a lot of folks. But it's interesting when you think about that, and everything you all are saying is from your role, whether it's a clinical role in social work or whether it's law enforcement, saying, we keep doing the same thing and it's not working. How do we get out of that? Sure. But it'd be interesting, you know, when one of the questions that I get most, and Devin, you alluded to this, is why didn't you do something sooner? And in my work, clinically, you know, 20 years ago, there were different things happening, right? There were
Sure.
different drugs, and there were different people dying. And you know, to me, my answer to that would be, I wish we did. And I just wonder how you all think about that.
You seem like
Yeah. I mean, listen, you know, as soon as Blake from the main line, you know, which is the upper middle class neighborhood outside of Philadelphia, started dying from overdose, it was a public health emergency. And law enforcement couldn't wait to be as compassionate as possible. But in the 80s, when it was black folk, when it was my father who had a problem with drugs, send him to jail. He can't be in my life. He was never part of my life. My family, my experience will never be the same. And that is rooted in racist drug policy that is now affecting white communities. And you know, and if we don't have a critical race lens on the current problem, like we met a couple of months ago and we like hit it off, right? But let's be honest, black folk in Baltimore ain't going to the police station to get help with their recovery. You know, we want to do something. Let's put a social worker in the barbershop. I'm there every 2 weeks to get my beard done. You know what I'm saying? So, I mean, yeah.
So, thank you, Devin, my brother.
I told you they had a lot to tell you.
For me, one thing that was missing from my education was the education on the history of our current drug policies of prohibition. You know, that they were centered and based upon race and culture from day one. If I had known that when I went through the police academy, I never would have worked undercover. I never would have commanded drug task forces. I never would have done any of that. I would have begun this work much sooner. Much sooner. The history is so important. On that premise alone, of the foundation of these failed drug policies, not just failed, extremely problematic as the damage that continues within cities like Baltimore, within certain neighborhoods in cities like Baltimore, Chicago, New York, and more. If I had known that, I would have begun this work a long time ago. And I think many others would have joined me. Teaching the history of these failed and problematic drug policies is extremely important for every classroom.
Yeah, I mean, I think just to echo what my colleagues are saying, I think if it wasn't affecting the families it's affecting now, we wouldn't be having this conversation. We wouldn't have had the paradigm shift in policing. I think now that we have and we are, and momentum is being gained in this area, law enforcement that I've had the privilege of interacting with are trying to take a lens approach, a more thoughtful approach about this. Even just a couple weeks ago, we were teaching a Recovery Coach Academy, and one of our instructors was teaching a class about white privilege. And so we're talking to people in recovery and law enforcement about that and how that relates to the work that they're doing. Because if people of all different backgrounds are not able to access the services or are not being diverted, then we're not doing the programs justice. So I think it's an incredibly important topic.
Yeah, and I think you're all alluding to the fact that, we need programs and policies that address this opioid epidemic for all of us. And for many of us who have been in the field for a long time, it's never worked for anybody to get the treatment that they need for addiction within our current system. So as we fix the system for all of us, how do we make sure that communities that were disproportionately affected before don't have widening inequity gaps as we're doing this work? So keeping that awareness, raising the veil of ignorance, it's, such important points. I wonder, is there people probably in the audience who are thinking, these three amazing leaders have done so much, they're really on the cutting edge of this intersection of work. What advice can you give people who might be in a different space or who want to engage in this work of policing and harm reduction, and something that they might take away from your wisdom?
I mean, I guess I could start. I think all of you are here because you care about this issue. You're getting an education that will give you the tools to make a difference in your community. Just speaking for myself, I didn't come from a law enforcement background. I was just somebody who this impacted personally, and I wanted to do more, and was able to use my background, my experience in nonprofit fundraising and managing organizations to be able to be part of a solution that's been very exciting and rewarding. So I think all of you have that potential. It's all about partnerships. So if you work in a community where your law enforcement agency is doing something like this, think about how you could assist them. And if they're not, think about how you could help them get started. These programs only work with public health and public safety partnerships, and all of you could be a really vital resource as your law enforcement agency thinks about how to approach this issue differently.
So I'll begin really quickly with giving you something that all of you can do. You all have representatives. You all have people that you have voted for, hopefully you voted, that you have voted for and put into office. And you need to educate them. We think that our policymakers know everything, or that their staff know everything. They don't. Introduce books to them like Chasing the Scream by Johann Hari, okay? And give them an education on history, give them an education on what's occurring now. Encourage them to make change. And I think the major change from where I sit, one of the major changes that needs to happen, number one, is we have to move to decriminalize, and this is the next step, in my opinion, to decriminalize possession of all drugs for drug users. Extremely important when we're talking about social equity, all right? And the final thing for me is, when you speak to your policymakers and write to them, we need to separate this issue again from the hands of our criminal justice system and place them appropriately into the hands of healthcare practitioners. Same thing with mental health.
Yeah. Vote, 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 vote. We think that, thank you, appreciate it. A lot of times we think that only the presidential election matters, right? And that's super important. However, local DA races, city council, mayor. You know who picks the police chief? The mayor. You know how much power the sheriff has in your town? A ton. We need to, our vote is the wall against bad policing. If your police chief will not embrace law enforcement assisted diversion, go talk to the mayor. If the mayor don't want to get it together, you got to go and your chief got to go. That's what it comes down to. We have allowed ourselves to become impotent in the political process due to apathy. We're apathetic. And if I could add one more thing, if you got a PhD or got some money, find an organization that's doing awesome work and come help them write some grants. Join the board. For real, I'm not even playing. I'm not even playing. There's like 20 harm reduction coalitions across the country. There's the National Harm Reduction Coalition, local syringe service programs, and like not a lot of us know how to write grants. We don't work at fancy universities. You know, most days I'm wearing jeans and a t-shirt. We need your help. Awesome researchers from the University of Sciences, the University of Pittsburgh have really been transformational for our organization. You could be that for another organization.
Thank you. So as you can see, there is a reason these three individuals are up here with us today. They are innovative, courageous, game changers, thinking about what so many of us think about. Something's not working. Something needs to be changed. How do we take whatever skills, passion, qualifications we have and start to move the needle in the right direction to create change and address this devastating opiate epidemic? If you could join, I hope you get a chance to speak with them throughout the day and engage with them. If you could please join me in just saying thank you to these wonderful speakers. Thank you all for being here.